Yeah, we think about Poiseuille's a lot when we think about therapy. So a great example of this, I'll just give you 3 examples. One example is, let's say you have significant blockages in the blood vessels going to your heart. One of the things, if you have that blood vessel blockage, you have a resistance. And if you have a high resistance, you actually need a higher pressure to essentially maintain blood flow. In somebody who becomes hypotensive, if their blood pressure drops too low, then the pressure to essentially push blood across that resistance becomes insufficient to maintain blood flow. So we know that somebody who becomes hypotensive, there's low blood pressure, if they got some blockages, you may unmask them and create problems like heart attacks. A second way that we consider this for therapy and treatment is the viscosity issue. So there are diseases where the viscosity of blood going through the small blood vessels of the heart is too high, and that's part of the Poiseuille's law as well. So here, let me give you some examples. So in big vessels, viscosity is considered to be Newtonian. Okay, it's considered to be, in lay terms, it's considered to be a fluid. When you get down to the smallest blood vessels of the body, the capillaries, blood flow has to move through those capillaries, and that's non-Newtonian. Essentially, blood is now separated into a thick, viscous plasma component and red blood cells, which actually have to deform to fit through the capillaries because they're actually bigger than the capillaries. So all of a sudden, you're talking about a completely different level in terms of the influence of viscosity. So there are diseases where red blood cells become stiff. For example, somebody's had a transfusion, somebody has sickle cell anemia, okay? Somebody has leukemias. Or there are diseases where the plasma becomes too viscous, things like hyperlipidemias, where the cholesterol or triglycerides of the blood are very high. In those situations, there's essentially more viscosity, more drag, and you can develop blood flow abnormalities just from having higher viscosity. Higher viscosity is a very difficult thing. If you have high cholesterol, you treat the high cholesterol, and in people who can't tolerate medications, we can actually sometimes do something called apheresis, where we pass their blood across something like a dialysis machine where we take out all of the cholesterol and all of the nasty lipid particles that are creating the viscous problem. Treating problems with the red blood cells becoming stiff is a little bit more difficult of a process, but new therapies are being developed. We do know also that there are some people who produce too many red blood cells, and that makes the blood a little bit too thick and viscous as well. And we just treat that by phlebotomy, removing blood from people and replacing it with plasma or with saline solutions. Lastly, in terms of therapy, the main determinant of resistance is R to the 4th, right? It's the radius. If you've got a blockage, whether it's a valve or a coronary lesion, so essentially when we start having problems with blood flow, we generally don't treat, it's less common to treat the viscosity. You can't treat the length of a coronary artery, so we go after the radius. And so that's led to procedures where we can open up blood vessels by doing balloon angioplasty, where we inflate balloons in vessels to open them up, or put in stents to keep them open. Or for valves, we go in and either replace the valve, or we can go in with a catheter and a balloon, open it up, and distend open the valve so it now opens much larger, or even implant in an artificial heart valve through a catheter. And essentially all of those things are just increasing the R function of the Poiseuille's formula, essentially increasing the area to decrease the resistance and relieve the stress of the heart and improve blood flow.